overnight. One of those was overseas acquired, a traveller from Doha in hotel quarantine. That means there's 6 confirmed locally acquired cases, all linked to the case that we notified yesterday, the Indooroopilly State High School student who lives in Taringa. The new cases are their family members, both parents and 2 siblings, and a medical student who tutors the student, as well as a staff member from Ironside State School, which is where one of the siblings attends. It is confirmed that these cases are all the Delta strain. That is the strain that is currently driving the outbreak in Sydney. We know from that experience that this Delta strain can spread very, very quickly. It is much more dangerous than the previous strains that we have been dealing with. It means these new cases mean that there are now 7 cases in the outbreak that we notified yesterday. We've seen from the experience in other states that the only way to beat the Delta strain is to move quickly, to be fast, and to be strong. That is now the nationally agreed approach. Just now, the Premier chaired our daily COVID meeting. We received the advice of the Chief Health Officer, and the Premier has ordered that we move strongly and implement all of the restrictions advised by the Chief Health Officer. We must go hard and go early. And so from 4 p.m. today, the 11 LGAs that currently have mask wearing requirements will go into lockdown. This will be the strictest lockdown that we have had. We can only, in these 11 LGAs, leave home for 4 reasons. To obtain essential goods, for example, groceries and medications, but only within 10 kilometres of our homes. So that is a stricter geographic movement restriction than we've had in the recent lockdowns. You can leave home for essential work, school or childcare. School or childcare is only for essential workers or vulnerable families. High schools will, for the first time, have masks for teachers, students, and everyone in the school. You can leave home to exercise with only one person who is not from your household, but you must do so within your local area. So that 10-kilometre restriction applies to exercise. And of course, you can leave home for healthcare, to care for somebody who needs assistance, to get your COVID-19 vaccination or to get a COVID-19 test. There will be no visitors to homes within those 11 LGAs. Funerals and weddings will be restricted to 10 people within those 11 LGAs from 4 p.m. today. Non-essential businesses will not be permitted to open. Hospitality, so pubs, clubs, cafes, will be restricted to takeaway only. Cinemas, entertainment venues, hairdressers, gyms, places of worship will all be closed. These restrictions will apply to anyone who's been in those 11 LGAs from 1 a.m. this morning. So even if you are no longer in those 11 LGAs, if you were here at 1 a.m. this morning, these restrictions apply no matter where you are now. They will be in place until 4 p.m. on Tuesday, but of course that will be subject to events between now and then. While the lockdown commences at 4 p.m. today, we would urge anyone in those 11 LGAs to go home and stay at home if you can. So if you are thinking about going out, please stay home if you can. If you are out and about now, please go home if you can. Grocery stores will stay open throughout the lockdown, so please don't think that you need to rush to get essential items. You will be permitted to leave your homes for essential items. Please don't rush our grocery stores. That creates a risk of infection that we want to avoid. We've been in contact with the supermarkets. They are all well supplied. So anyone rushing, stockpiling, it just makes the job of our grocery stores, our supermarkets, and the essential workers in those supermarkets even harder and more risky. Our message to people in the Southeast is we have been here before, but this time it's different. We cannot afford to be complacent just because we have done so well so far. We all have to comply with these restrictions. All of the governments of Australia now recognise that when dealing with the Delta strain, the only way is to go hard and go early. That is what we have been advised to do. That is what the Premier has instructed that we do. It is what we are doing from today. Both Indooroopilly State High School and Ironside State School students and staff are all now in quarantine for 14 days. All other schools in those 11 LGAs will be closed Monday and Tuesday, except for those essential workers. It is our intention that this is a short lockdown and that we can deal with this outbreak within days, because we know that that's the best way for businesses to recover, the best way to keep people in work, the best way to keep our economy going. But we also acknowledge that this lockdown has come not long after the last one, and that's why for this lockdown we will seek to have a compensation package in place. We will work through the details of that today. We will contact the Commonwealth and seek to have similar compensation arrangements as those that have been applied in other states during these lockdowns, and we'll have more information about that when we update you tomorrow. I'll ask the Chief Health Officer to provide more detail.
Thank you very much, Deputy Premier. So yes, we had 6 new community-acquired cases yesterday, so there are now 7 in that cluster, and they are related to 2 people who returned from overseas and were in hotel quarantine. So there are now 9 linked cases. I still don't have the direct link from one of those 2 cases through to these new 7 cases, but I know through whole genome sequencing that that is where the transmission has occurred. So today we now have all 5 people in one household have been infected, so all 5 of those household members. We know that Delta is a particularly infectious strain. Then we know that we have another person today who is a medical student at the University of Queensland who's a tutor for that 17-year-old that we announced yesterday. She's infected. And I suspect, although it's hard to know because of the very rapid transmission timeframes, I suspect that that medical student is the index case and has taken it into that household, and then it is spread within that household. Then we have the child, the youngest child in that family attends Ironside School, and one of the teachers there is already positive. So we yesterday put all of the students and staff who attended the high school, the Indooroopilly State High School, into 14 days quarantine. We will be doing the same today with all students and staff who've attended Ironside School. They'll be in 14 days quarantine. And now we are rapidly contact tracing the medical student. She has been to a lot of venues, a lot of places, at Royal Brisbane and Women's Hospital, at the University of Queensland, at the Translational Research Institute at the PA, and also she has a sibling who works in a hospital. So we're urgently working through all of those, but there are a lot of places she's been, and we'll be rapidly getting that information up on our website. So please, anyone who has been in Brisbane or any of those 11 LGAs in the last week, could you check our website and check it every single day going forward, because we will find more exposure sites. Then we are also working through the school teacher, where she's been, and through the other 4 members of the household with that original case. But I expect there are going to be an enormous number of exposure sites all through Brisbane, and probably as well through the Sunshine Coast and further. So it's really important people check. Then of course, the most important message of all, if anyone has any symptoms at all, this is the time you must come forward and get tested immediately. You get the first sign of those symptoms, because we know and every single time we see it, that you're actually most infectious in the 2 days before you get any symptoms. So if there's any delay while you wait to see what happens with your symptoms, we've missed that critical first part. And we know from Sydney, and here indeed as well, that people transmit Delta in as quickly as 30 hours after they're first exposed. And that's why we need to have a particularly restrictive lockdown. This is one of the most restrictive lockdowns we've had since the start of the pandemic, which makes sense because this is the most infectious variant we've had since the start of the pandemic. So for the next 3 days, I just ask everyone, stay at home. The only real reason you need to leave home is for health care or to provide support to a vulnerable person. Hopefully people have got enough food at home. If you don't, of course you can go shopping and buy more food or order it online or do whatever you need to do. But if you don't need to go, if you don't actually need that particular item of food, you're going to have to change whatever you're cooking, then please do that. Stay at home. That's the safest place for everyone to be until we can sort this out. Those 2 schools alone are very large schools, and there have been a lot of people who've been potentially infected days ago who could already have started spreading. That's what we've seen happen in Sydney. Then please, in the past we've allowed visitors to your home. We've capped it at 2. Please don't have visitors to your home. Don't go and visit anyone else unless you need to, because that person is a vulnerable person and actually does need you to go and see them. Otherwise, if you can delay, we're hopeful this will be 3 days. Let's all hope it is 3 days and stay home. And the more people who stay home and the more people who limit their movements, the more likely it is that it will only be 3 days. Then I am asking anyone who was in any of those LGAs, if possible going back, definitely 1 a.m. this morning, as the Deputy Premier said, but if possible going back to 1 a.m. yesterday morning, because I think there was significant risk in Brisbane yesterday, that when you go back to your regional parts of Queensland, that you follow this lockdown, that you stay at home and your family stays at home with you. Because if you've picked up the Delta variant, you could pass it on very, very quickly. So from 1 a.m. this morning, it is a rigid requirement. When you go back home, anyone who's been in Brisbane from 1 a.m. this morning or any of those LGAs of Greater Brisbane in the South East Queensland, then when you go home, I'm asking you and your entire family to stay in lockdown and only leave for those reasons. Now, of course, people outside Brisbane or the greater area of South East Queensland can come home to Brisbane, but then you need to go into lockdown when you come home. So really it's about minimising your movements, and if we do that and we do it how we've done it so well before, if we do it with those enhanced restrictions, then hopefully it will only be for those 3 days. The one reason that I do want to encourage people to absolutely leave home, if you're well, leave home and go and get a vaccine. So anyone who is 60 years of age or over, please make sure that you go and get your first dose of vaccine if you haven't had it already, and your second dose when it's due. If you're under age 60 and you've got a booking to go and get Pfizer, then go and get Pfizer. If you're due for your second dose of Pfizer and you're in that 3 to 6 week period, then go and get your second dose of Pfizer. Now, if you're in quarantine, then if you're due for your second dose, you need to get your second dose if it's in that time frame and can't be delayed, so if it's Pfizer. But please ring up, and that vaccine clinic will make special arrangements. If you're due for your first dose, now's not the time to be leaving quarantine to go and get a first dose. So there's a lot of information there. Please go and look on our website, and that'll give you specifics and detailed information. And there are a lot of frequently asked questions there. So please go through there if you have any questions. But this is essentially quite straightforward. For the next 3 days, I need everyone in those 11 LGAs that have been wearing masks, those 11 LGAs, to stay home and not leave unless it's absolutely critical. Thank you.
So we've seen already what Delta can do. Over just about 5 days, we've had an entire household of 5 people infected. And one of those have already passed it on through their school to a teacher. So we know how dangerous Delta is. We know it can spread quicker than any other variant we have dealt with over the last 18 months. National Cabinet and the health ministers were presented this week with the Doherty Institute modelling, and it now shows if you want to manage this, if you want to stop the spread, you must go hard and you must go fast. We have one chance to get this under control, and we need everyone to work with us to make this happen. No movement, stay home. If you are unwell, even with the slightest cough or sore throat, go get tested. We will be looking at our testing clinics. We will be monitoring demand. We will be setting up extra clinics, so please check the website to see where the closest testing clinic is to you. We will also work with private pathologists to ensure as many of them across the 11 LGAs can open up over the weekend as well. And of course, we will be asking the Commonwealth to have their testing clinics open without needing a referral so people can walk in. I want to remind people why we need to do this. New South Wales had 1 case on the 16th of June. 38 days later, they are at 3,000 cases from that one person. 38 days, 3,000 cases. Sadly, 13 people have died just from that one cluster. We have to get this right. We know Queenslanders will do the right thing. We've been here before. We know what we've got to do. We've got to be more vigilant, more compliant than we've ever been before. For those people who are going to be contacted as close contacts and asked to go into quarantine for 14 days, you must stay in quarantine. If you need any assistance whatsoever, please ring 134 COVID and we will get you the support that you need, but you must stay home. If you are going out to get a test, go straight back home. Do not go anywhere until you've got your result wherever you are in Queensland. So if you are outside of those 11 LGAs, it is not okay to go to the shops after you get a test. You must go straight home and stay there until you get your results. This is absolutely critical. We have to get this right. We want to keep everyone safe. Queensland's done such a fantastic job, and we want to make sure we keep it that way. So please, everyone, check out the website, look at what the restrictions are. The message is simple, as Dr. Young said. If you are in those 11 LGAs, if you've already been wearing this mask every day because you know you have to, then you are one of the people we're talking to today. Go home, stay there until Tuesday afternoon, and we hope we can get through this quickly. But we know it works. We've seen it before. So please follow the rules. Of course, there will be police out there checking compliance. We just can't afford to slip up. We need this to work and we need everyone doing the right thing. And I know we will get there. Thank you, Queenslanders.
The Minister is right. The vast majority of Queenslanders have done the right thing throughout this pandemic response. But what we need is everyone to do the right thing for the coming days. What we don't want to see is the situation, when, as we saw yesterday, where police had to hand out 127 masks and fine 3 people for failing to wear masks when told to, and indeed in one incident at a Coolum cafe, having to arrest a person who simply refused to comply with our directions when they were operating a business and not wearing masks. That is simply not good enough. You can expect to see additional police on the roads in the coming days. We will be tasking our officers to go out there and make sure that all of the exemptions are complied with as they are intended to be. So to be able to do that, please make sure that you do understand what those exemptions are that you can leave your house for. And if you do have to go and do that, please make sure you take your mask and wear it as you are required. Also, I suggest that you can carry identification that proves that you where you reside, so you can verify you are within the 10 kilometres. We will, as we always have, take an educative approach and work with people. So if you're trying to do the right thing, you will be looked after. You will get the right outcome. If you choose to do the wrong thing, there are strong consequences. And can I remind people that it carries a $1,378 fine for any person who does the wrong thing in disobeying the directions within this. And as I've just mentioned, there are also the ability for our officers to arrest people and put them before a court if they take it to the next level. I'm also informed through our intelligence that there are people planning to protest in the CBD of Brisbane tomorrow. Can I say really clearly, now is not the time. Now is not the time for protests in our community. We ask that you do not go ahead with those protests. You can expect a police presence, and you can expect the police to make sure that the Chief Health Officer's directions are obeyed. Thank you.
Dr. Young, can you explain the 10K rule and why that is so important? I need to know.
I just don't want people going out of their immediate area and then spreading the virus to a broader area. So at the moment, I don't know where this virus is in the South East Queensland. It could be anywhere. It could be in the Sunshine Coast because we had one of those original cases up there and they live in Buderim. It could be down in the Gold Coast because we had one of those original cases down there when they were being managed. We know it's in Taringa and we know it's in Indooroopilly, and we know that 2 members of that family went out to Ipswich to attend the vaccine clinic. We know that this medical student has travelled widely through Brisbane. So I don't know today where this virus is in the southeast of Queensland, but wherever it is, I don't want it to go further. I want it to stay where it is. And we know that the vast majority of cases are spread by people breathing out and other people breathing in. That is the vast majority of cases. So if I can keep the people in a restricted area, I can keep the virus in a restricted area. So I don't want people leaving their home for more than 10 kilometres, unless of course they're in one of our fewer rural postcodes where they don't have shops. So of course use that common sense, which I know people do. And also people often travel beyond 10 kilometres for healthcare, so they can do that, or to look after a vulnerable person. But just minimise movement if you can.
Can you just explain to us where the student got it from? You said it's hotel quarantine.
Right. So we've had 2 cases in hotel quarantine that arrived in Brisbane on the 29th of June. So they both flew. One flew from Indonesia, one flew from the UK. They both ended up in Singapore. They were both on the same flight, but they were 3 rows apart, opposite sides of the plane, those 2 people. Then they flew into Brisbane and went into hotel quarantine at the Ridges South Bank. Now, one of them tested positive day 1 after arrival. The second tested positive day 5 after arrival. So, and they both have exactly the same genome sequence. So I think the first person's given it to the second person, but they could have done that in Singapore. They could have done it on the plane. They could have done it in hotel quarantine. Then one person was transferred to Gold Coast University Hospital for care, because as you know, all positive cases we admit to hospital. So one went to the Gold Coast University Hospital for care. Once he finished his treatment, he went home to WA. The second person was admitted to the Sunshine Coast University Hospital. Once he finished his treatment, he went home to Buderim. So I think that one of those two cases has led to transmission to someone who I don't know, who has then led to further transmission, and eventually I think the most likely scenario is this medical student has acquired it. I don't know how. Then most likely scenario is they have given it to the student they were tutoring, the 17-year-old that we announced yesterday, who has then given it, or possibly the medical student has given it, to the other 4 people in that household. Does that explain it? No, there's no link to Townsville at this stage. I'm not sure. There's no issue at all. The Townsville link was that Magnetic Island case, which was a while back, that is totally genome sequenced. There's no relationship there. So unless they're concerned about that past one, but I'm not concerned about it. No, today I've got no concerns about Townsville.
Given where we are, do you think it's very likely though we'll detect more cases in the community?
Oh, extremely likely. That's why we need to go into a lockdown, and that's why the lockdown has to be the most restrictive we've ever been in, because this is the most infectious virus we've ever had.
So what do you see that threshold being in terms of getting out of lockdown?
Can we just have the next 3 days? I'll see how many cases. So we're doing an enormous amount of contact tracing, and thank you to all of those people who've already been involved, all of those families from Indooroopilly State High and now from Ironside. We'll just be doing enormous amount of contact tracing and requiring people to go into quarantine.
If people don't do the right thing and if they do protest tomorrow, how quickly could it become a New South Wales situation?
Very quickly. That's why I need people to do the right thing, and I know that the vast majority of people will do the right thing. They have every single time. I've been beautifully not surprised, because Queenslanders always do the right thing. But it would only take a small number to do the wrong thing for this to get out of hand. So yes, please don't protest tomorrow. Protests are very, very important. I agree with protests. They're an important part of our democracy, but just don't do it tomorrow. Could you wait till we're not in lockdown and then have a protest?
There are NRL games due to be played this afternoon and tonight. Will they go ahead?
No.
This might be a question for the Deputy Premier Minister, but on National Cabinet last night, do we change our approach to lockdown and border closures once 70 or 80% of the population is vaccinated? Are you happy with that benchmark?
I think what National Cabinet resolved was that it would depend on the circumstances, and that's both the circumstances of the vaccination status of the population as well as the nature of the outbreak and the strain that you're dealing with. So I think it's very, very hard to set hard and fast rules about it, and I think that's the kind of conversation they had.
Can you clarify what type of support the government is considering? Is that for people who lose out on wages, or is it for business owners?
We'll be looking at both. We'll be looking at both what compensation arrangements should be provided for businesses and for workers who are affected by the lockdown. Obviously, we'll be seeking to get a similar level of support from the Commonwealth as other states have received, and we just ask you to bear with us throughout the day as we work through those details and hopefully have something to talk about tomorrow at our update.
The Pinkenba site's been given initial approval. Have you seen that report to the feds yet?
I have, and we certainly welcome the effort on the Pinkenba quarantine site. We wish we had alternatives to hotel quarantine now. We would prefer they were regional hotel quarantine, but the Commonwealth is building that facility for us at Pinkenba, and we just want to see it built as quickly as possible while ensuring that it delivers all of the outcomes that we're looking for.
To clarify on the NRL, the games won't be played at all, or just no crowds?
No, there will be no football matches. So no community sport, no professional sport, nothing for the next 3 days, starting as of 4 p.m. today. But I would hope that anyone who's out there concludes whatever they're doing and goes home. So it's only officially starting from 4, but it would be a good idea that if people are hearing this message, and I'm sure they are, given you're all texting everyone, that they respond, which is perfect. No, thank you. I'm very grateful. No, please keep going. I'm extraordinarily grateful. So the quicker this message can get out, the quicker people can hear it and the quicker people can follow it. Don't wait till 4 o'clock today to follow this message. If you hear this message now through our media, through social media, through what we're putting out, please respond as soon as you safely can, of course.
With regards to the masks at schools, is that for people of all ages?
For high school. So anyone who attends high school, any teachers, any staff, any pupils will need to wear masks, and in primary school, any adults.
Should people who are aged, I think, I don't know how old, like 12 to 17, should they be wearing masks when they're in the general public as well?
Oh yes, masks are only exempted for people under age 12. Yes, so yeah, it's just that for high school, so there might be some 11-year-olds at high school, they can wear masks as well. So anyone at high school needs to wear a mask.
The Ipswich vaccination hub exposed site. So did the 17-year-old and mother go there to try to get a jab and they were turned away when they were sick and sent across the
No, the mother had a booking, so she was vaccinated, and it was picked up that the 17-year-old was unwell, so she was sent to go and get a COVID test.
One of those NRL games is in Rockhampton. Will it still be off considering the players have been in Brisbane?
Well, it depends where they've been. If the players have been in Brisbane this morning, then yes, it will be.
Dr. Young, so the school will go ahead on Monday?
Yeah, school will go ahead on Monday and Tuesday, but only for the children of essential workers. And essential workers are those people who genuinely must go to work and can't do their work online from home. So there should not be that many of them. So children of essential workers, and also for vulnerable children. And every school knows the vulnerable children in their school, and they've had this happen before, so they'll have that in place.
How does that work for childcare and daycare?
Same arrangement, yes, for childcare, daycare, school. It's the same arrangement for children of essential workers and for vulnerable children.
Okay, thank you.
Thank you. Oh no.